Momelotinib is a recently approved drug for myelofibrosis, and that gives us a very good other option for patients with myelofibrosis. In the UK, we had access to Momelotinib via the compassionate access scheme, and also very recently it was approved for first-line myelofibrosis with anemia. In the UK, we work collaboratively across many centers by the NPN study group, and we collected data of use of Momelotinib in the real world. We are very pleased to say that we have demonstrated good efficacy with Momelotinib, good anemia responses. We measure them at 6 weeks, 3 months, and 6 months. And actually, for the patients that were able to stay on Momelotinib for 6 months, we have demonstrated more than 60% responses in anemia. Momelotinib can provide a very good options for clinicians treating myelofibrosis patients. We also looked into the safety of this drug, and we have identified peripheral neuropathy as the most common adverse event in the real world. This is very important. However, in most cases, the patients were able to continue the drug. The neuropathy was usually grade 1 or grade 2, and given the response that they had, actually they could tolerate it very well, and the clinicians were able to continue the treatment. The second most common adverse event was GI symptoms, but most interestingly, we have identified a certain percentage of patients that they developed thrombocytosis, which was a bit unexpected. We think that this may have to do with the inhibition of the ADCR1 receptor of Momelotinib, as well as the JAK inhibition, and that may affect the hepcidin and iron regulation in patients. But this is definitely an area that we continue to study, and I think it warrants further exploration. In summary, in our patient cohort, Momelotinib was a very good treatment that achieved good anemia responses, and as we continue to use it, we can learn more. And given that in myelofibrosis we have a few drugs available, I think it's very important for patients that will have another option to offer to them with a relatively safe profile and also good efficacy.